The modern airport, the hub of America's freedom and prosperity. The Transportation Security Administration was created in the aftermath of 9/11 to protect the American way of life. The agency is committed to all aspects of safety and security. In response to public outrage over full-body scanners and the alternative enhanced pat-down method, the TSA is joining forces with the National Institute of Health to modernize and enhance both airline security and the health of Americans. Effective immediately, all airports will be participating in the SecureCare program. Let's take a look at the goals of SecureCare. SecureCare will provide fiscal responsibility by combining the goals of the Healthcare Reform Act with national security interests. SecureCare will ensure homeland security because patriots everywhere will see the value in implementing the act. We'll establish equality by forcing all Americans to participate in the program. And most importantly, we'll defeat the terrorists. Everyone knows that millions of Americans are without health care, and everyone knows how much of a hassle the lines are at the airport. SecureCare will kill two birds with one stone by regimenting air travelers into orderly queues and providing needed health examinations. So how will this all work? Let's follow the Jones family as they enter the process center. Mrs. Jones is accompanied by an initial TSA screener to the women's intake facility. There, friendly and professional TSA agents will begin the extensive female-specific medical test that will double as a security exam. Meanwhile, Mr. Jones will be taken to a similar men's facility for invasive but otherwise security-enhancing examinations. But what about little Jimmy and Susie? They will be separated from their parents. In addition to similar gender-specific medical examinations, trained TSA agents will ask the now isolated children about their health and their parents' potential subversive or terrorist activities. Mrs. Jones will be wheeled to a private room where she'll be given a sedative so that the TSA agents can positively identify the indeterminate and suspicious bulge in her stomach. The initial scan indicates that all parts are in place, but the bulge could be concealing a bomb. After fine-tuning the scanner, an additional subject is revealed. Labor will be induced in order to ease the process of interviewing and examining the new subject. After all, we don't know who the father is. The trained TSA agent prods and pulls the new subject and then prepares him for interrogation and examination. In the men's wing, Mr. Jones is having an easier time of it. After a cursory once-over by an agent, he'll get a few x-rays, a CAT scan, a stress test, a deno exam, treatment for tennis elbow, and finally a prostate exam. Yep, everything's in working order here. Little Jimmy's minor violation is cleared up with a mandatory vaccination. And Mrs. Jones? Once TSA agents positively ascertain that the bulge is not a terroristic threat, he is united with his mother through a modern transport system. Mrs. Jones is now cleared to fly. For those travelers who offer resistance to SecureCare procedures, TSA agents are authorized to use our new thought scanners and truth serums. Maybe they've been harboring violent thoughts or an eating disorder. Perhaps they've been whispering subversive ideas. Or maybe they were once a dirty, filthy hippie, entertaining thoughts of public protest and flag burning. The TSA will deal with these unpatriotic ingrates appropriately. All information gathered will be kept on file in a centralized location. TSA agents are thoroughly trained to identify and examine all potential hiding places for nuclear, biological, and aerosol contraband. All SecureCare procedures and treatments have been tested and approved by the National Institute of Health after extensive animal testing. In the future, SecureCare will be expanded to those who don't travel. TSA field agents will identify and locate private sickness that threatens our society along with those unpatriotic Americans who refuse inoculation. For those unwilling to participate in SecureCare's Happy and Safe Travel program, the TSA has developed a remediation program. Subversives will be relocated to remediation camps where they'll be schooled in patriotism. This is nothing new. We've done it before. The Transportation Security Administration, through the implementation of SecureCare, is dedicated to keeping air travel safe, providing free health care, and creating patriotic citizens.